Hi, everyone. Thanks for logging into the show. This is Beyond the Checkbox. I'm your host, Ryan Todd, psychiatrist. Today, I'm talking to Jeremie Saunders, who really has become a thought leader. He is a podcaster. He does a number of talks, mostly around his experience with cystic fibrosis. And he's created this community around a podcast called Sickboy. And that community is for those who have chronic illness, and talking about it in a real way, providing some levity around it, and also returning the human aspects to that person by way of a funny, awesome, light podcast. So I'd encourage you to check his podcast out, Sickboy. And what I got from this episode and talking to him was a lot about what it's like to live with a chronic illness, but also the thoughts around it, the mental health around it, thinking about, in his instance, I'm going to die when I'm 30, and then seeing these breakthrough drugs come through in the last 10 years. And now he's likely to have a normal life expectancy. And that mind shift has been massive for him and interesting and surprising. So we talked a lot about that, and I was grateful to have him as a guest. Easy to talk to and funny. So I hope you enjoy the podcast. Thanks for joining today. I'm Dr. Ryan Todd, a psychiatrist with over a decade of experience. And in this series with leading experts, we will explore the complexities of mental health, breakthrough therapies, and today's hottest topics. This is Beyond the Checkbox, Mind Masters. I think I'm likely perceived as kind of like a fly-in, fly-out consultant advisor, and the interactions that I have are really bizarre because I meet someone for the first time and I ask them about the most intimate questions of their life, and they answer. That's a crazy part. No one ever says, no one's like, yeah, you know what? That's too personal. But because we have all this built up around what it means to be a doctor, and that trust and curriculum and that framework around that, no one ever questions my motives. Very few people are like, why are you asking me about a sexual history, or do I do IV drugs, or was I abused as a child? No one ever pushes me on that, which I've always found that sort of bizarre and interesting. But I imagine you going through a chronic illness phase, you get asked intrusive questions all the time and you're expected just to answer them.
That's sort of what stemmed the journey into creating Sickboy in the very beginning. So the idea came from the fact that so I live with cystic fibrosis, and I've been dealing with that my entire life. And whenever the conversation would come up in new relationships, company, at a party, meeting someone for the first time, having conversation, if the topic would come up that I live with cystic fibrosis, there would always be this especially if the person knew what that meant, there would be this reaction of, oh, okay. And how it was immediately it became oh, for fuck's sakes. Okay. So now we got to do this back and forth where I need to go it's okay. I'm good. I'm good to talk about this, because people would clam up, they get awkward, they get weird. They didn't know what to say. But then when they would feel the doors had opened to I don't know, inquire or be a little curious, they would really tiptoe. And I'm God, that's worse than small talk. It's so grating, and it's I'm so uncomfortable because you are uncomfortable.
Why do people do that? Is it you're kind of a dead man walking and we don't know how to proceed?
Yeah, I suppose
what's
so.
The psychology behind I'm going to tiptoe around this? Why are people so protective of you in a conversation?
I think because the reality is that, okay, so if I just laid it out for them, I live with at the time, I'm living with a genetic disease that has left me with this knowledge, or this deep knowing that I'm going to be dead probably within the next 10 years. And that transition into death is probably going to involve a lot of discomfort. And, like my lungs are going to start failing. I'm probably going to have a transplant. That's going to run out after a certain amount of time. It's going to be messy. It's going to suck. And then I'll be dead, and everybody who loved me will be sad. And so if that's running through this person's mind, they're going, well, fuck, I don't want to say anything that's going to make him like break. He's already going through so much. Yeah, exactly. Make it worse. Whereas like in reality, all I want is for you to make the darkest joke you can about the situation, because that's how I feel and navigate, like feel comfort in that position. That's how I navigate this, because it's my reality. I can't, it's not something I can to escape. So I'm going to use humor to, you could say it's like a coping mechanism, or you could say it's being used as like a bridge to like wade through the awkwardness and get to like the heart of something that matters. Now, of course, not everybody knows that that's like, maybe that's my vibe, or that I'm comfortable with that. And so that's where I came in, where I made it very apparent and very clear. Hey, like, and by the way, don't tiptoe. Like, I'm going to make some self-deprecating jokes about the fact that I'm going to die soon. You're going to get that as a cue to be like, hey, okay, everything's cool. Like I feel a bit disarmed here because he's.
Yeah, that's your in to being like, we can talk about it, but it's not like, it's not my master status. That's not all there. Like we can get through this.
Mm-hmm. Yeah. And that humor signals to them, hey, I'm okay. I'm comfortable. I've thought about this. Yeah. Like thinking about your own mortality oftentimes is like an uncomfortable thought for most, but I've done this my whole life. It's all I've thought about since I was 10 years old. That was the time where I became aware that CF was fatal. So from 10 up till now, like that's all I've thought about. Eventually hopefully eventually you get around to a point where it becomes, you learn to accept your fate. And then, it's up to you to do with that, however you will, lean into that. For me, it was using humor to be like, hey, this is like, it's all good. And by the way, I'm willing to talk about anything that's uncomfortable. If you're dealing with something and you want to bat around the jokes and the laughs to like open that door so that we can feel like there's some trust here. Like you were saying, as a doctor, as a physician, people just don't question it. Yeah. Because you're coming into it and they're going, well, I guess like I'm just anticipating he's going to ask me some questions about this, that, or the other thing. And like, if I don't tell him, maybe that will be bad for me. Like,
yeah, that's the thing. If I don't like, I was seeing a consult, and before the patient's mom left the room, the patient's mom said, it's okay to tell him everything. But so she's saying,
right.
Like, make sure you tell this guy, because that will get you the most help. If you don't, you're not going to get the help you need. So people are almost afraid not to tell me everything, or they're not going to get the help they need.
Right.
And it's funny because everything not funny, but what I wonder if you've explored more about how this connects to the stigma around mental health, because like, I want your opinion on, is it jokeable? Like, is that a good way to broach, like, hey, I have chronic depression or like severe anxiety? But also the accept your fate part's really interesting, because there's this kind of canon that exists where we're not supposed to accept that you have mental illness. You're supposed to fight it at all costs. Yeah. And we don't have in psychiatry an end-of-life designation. Every other field does, like pulmonology in your case, or oncology. You get palliative care. In psychiatry, there's no, okay, this condition is so severe that this person should get made or it will kill them eventually, and we have to have a harm reduction approach. There's almost none of that in mental health. So I'm wondering about patients with severe mental illness, if they've come to accept their fate and how society sees that, because you are kind of allowed to accept your fate because it's like this medical illness that's been thrust upon you in a way. Not, it's not your fault, but we still sort of attribute mental illness as like their fault.
Right.
That's a thing that floats around that we don't really talk about.
Yeah. Yeah. And there's like an ambiguity to mental health issues, right? Like, so like I was diagnosed with clinical depression, I don't know, a couple of years ago. And like, actually I was having this thought literally I think it was this morning. I was in the gym and I was thinking about how like, right, I'm doing very well now. Like I feel like I've come out of that position of where I was dealing with clinical depression. But there's this low-lying kind of like, I feel like I'll never be the same. I'll never be that version of me prior to the diagnosis where like the notion of depression, I don't even know, wouldn't even know what that would feel like, other than the fact that like I felt sad before and that's the only way I could relate to the idea of depression. But now that I've gone through the diagnosis and I've experienced it and I've been in the throes of it and now I'm out of it, there's a part of me that's like Jesus Christ, is it gonna like just pop up and get me again at some point? Like it feels like it's in the wings and like one little trip up and it'll just pop in and grab me again and pull me down into the shadows. Whereas with CF, it's like you feel it. It's there. Even in the days where you don't really think about it or feel it, like, it's there, it's in your body. It's this thing that's like, it's in my DNA. It's literally in my genetics. Like, whereas this mental health is this ambiguous, I don't know. It's you can't latch onto it. There's nothing tangible. And so I think there's gotta be some element of that trickles into the way that we, again, like talk about it or think about it, that makes it feel like this thing that's a little harder to grasp, a little harder to like, I don't
visualize.
know. Visualize. But it's funny that you bring that up because like when we started, the podcast, like a decade ago, the first recording we ever did was me and my two friends, Brian and Taylor, who co-host the show with me. And so the idea was for them to like ask me all the questions that they'd ever want to ask their sick friend that they just never like thought to ask or had the permission to ask.
Yeah.
And we were like, hey, that was really fun. And that was hilarious. Like, and it was kind of therapeutic for me. I got to get some stuff off my chest. And for them, they got to learn about me. And so we were like, okay, well, like, we're best friends. So obviously we had fun, but like, can we recreate this with somebody else? So we thought of the sickest person we knew at the time, which is my buddy, Matt, he just had a brain tumor removed. So I was like, Matt, you want to come in and we'll make jokes about, your brain cancer? And he was like, yeah, sure. And so we did the same thing. It was, again, this like amazing, beautiful, hilarious conversation. And then we started having people reach out being like, hey, I want to come on and talk about my experience with diabetes, or I want to come on and talk about, Then we had this, I had someone reach out to me and they said, you don't know this person. Her name's Nadine. She's a friend of mine. She heard what you guys are up to. She would love to come on and talk to you guys. She has bipolar.
Yeah.
And I was like, I don't know. Like, should we do that? Are we, like, what if we break her? Like, I don't want to.
Yeah, it's funny. You had that same like timid reaction.
Yeah. Yeah. I was like, oh God, I don't know. Like, I don't want to be the cause of her to have some sort of mental breakdown.
Yeah.
And so we sat her down and we had the conversation. And then by the end of it, we were like, oh, wait a minute. What? Like, what? That's so funny that we just like thought that that's the way that this was going to go. But again, like Nadine, she was like, no, I want to come and sit and have this conversation, knowing full well that there's like the point of it is to lean into the levity of the absurdity of the situation that I am in living with bipolar and how that's affected my relationships and this and that and suicidal ideation and, things that are really heavy. But like, I want to come on and I want to engage in that conversation because I don't ever get to talk about this. And when it was over, we were like, oh, this is not that much different than sitting down talking to Matt with cancer, me sitting down talking about CF. It's like, I know what I'm signing up for here, and I am giving you permission to engage in this conversation with me where we don't have to make it awkward and we don't have to be afraid of saying the wrong thing or making a
protective.
Exactly. Like that walking on eggshells, get that shit out of here. That's not helping anyone. So we just like get that out of the picture and just have this like 1 hour free for all conversation and be open to like laughing when most people would think it's just completely absurd to laugh.
I wonder what needs to happen for that to be like the standard. Like that, like I sort of think something needs to be treatable. Like that's kind of how I thought about it. Like for everyone to be able to joke about it, it needs to be treatable, or we continue to have to like, what's going on there? Like people joke about broken legs, and I bet they didn't do that like, I don't know, in the early 1800s when like a broken leg meant you were going to get gangrenous and lose your leg and probably die in surgery. Like if you're like a Civil War soldier, or like, I'm trying to think of other examples where people joke about it now, but it was no joke. Like, my wife got pneumonia, and it was like, it wasn't funny, but it was like, yeah, you're gonna be fine. You'll go. She was in the hospital for like a day. She got antibiotics, IV antibiotics. It was fine, and we kind of joke about it now. And it was, so I wonder if that's the standard, like of when humans are in our society, at least, we're more comfortable talking about something, is when like, okay, you're gonna pull out of it. It's treatable. It's all fine. But up until that point, people have that timid mode or tension mode.
I don't know. I think, I mean, so again, it's so funny. Like we're talking about this like with such general broad strokes, and like it's going to be different for everyone, right? Again, like in my case, I spent my whole life meditating on the fact that I'm going to die by the time that I'm 30. At least that was what was running through my head, right? I'm 37.
Can you just like let us in a little bit to that? Like that must have been,
sure,
I know you don't know any other experience, but what was that like to think you're going to die by 30 when everyone else is going to live? What was that?
Yeah. So, okay. So, you know what? I will here, let me answer that. But before I do, I just want to touch on that one piece that you said about it needs to be curable, or it needs to be fixable, because maybe for some people, yes, like I can't really handle it if it's not. And so like, we shouldn't go there and joke. But there was an example of a conversation we had on the podcast a long time ago with a guy named Leighton. Leighton he had terminal cancer. He was going to die within a few months. And he had a very young son and a beautiful wife. And he knew that his life was coming to an end. And we sat down, we had this conversation with him. It was one of the most emotionally raw, beautiful, heart-wrenching conversations. But also there was some stuff in there that was so funny. And this was Leighton's doing. He brought up how he was putting in all these sort of these pieces together for a project for his son when his son gets older. These ways that he was going to communicate with his son when his son's like 17, 18, curious about life, long after he's passed. And I think I asked him like, hey, like, have you thought about do you have thoughts around your wife, Candace, moving on after you're dead? And what comes up for you there? Like, how does that? And he goes, oh yeah, we've talked about it. And of course I want her to find love when I'm gone. How selfish would that be of me to not be open to her being in love with somebody else after I'm dead? That's crazy. The only thing that I just asked of her, and it was less of an ask, it was more of a demand, is that man cannot have a penis larger than mine. And we died. Like, I mean, that was so funny to us. And he's laughing. It's like, of course it's a joke, but I'm sure he said that to Candace, and I'm sure they both shared this like beautiful, jovial, like gut busting laugh because it's so absurd. And so like, again, just to like put that out there that there's this example of like, there was no fixing Leighton's situation. He was going to die.
Yeah.
But that's funny. Like that's a good, solid, funny joke. And it makes this whole thing that's extraordinarily uncomfortable, this thought of like his wife moving on when he's dead. And it just makes it more light. You know, it makes it adds to that, I don't know, the beauty of like that, of that human experience. Anyway, to come back to your point about meditating on death. Yeah, it's so cystic fibrosis. When I was 10, I think I mentioned this earlier. I had stumbled across this pamphlet that was intended for my teachers, I think, to like give them a sense of like what it was going to be like to have a kid with CF in their class. And in the pamphlet, there was a sentence that said the average life expectancy of someone living with cystic fibrosis is 30 years of age. And prior to reading that, I had just thought like CF was like a you know, a day-to-day annoyance. Like I had no concept of this being a thing that actually came with a shortened life expectancy.
Yeah.
My parents never told me because that's what the healthcare providers had told them. It was like, don't tell the boy. He will find out and then he'll come to you with questions. And so I found out, but I didn't have questions. I took that and I just buried it and let that like fester. And my mom didn't find out that I knew about that until I was like 17.
Whoa.
And which was like such a heartbreaking thing for her. And I think I had like harbored all this sort of like internal like hatred towards my parents for not ever telling me that. And so up until the point where I was like 20, I think there was like a deep seated anxiety around the fact that like, oh, I'm 15. Well, I guess I'm halfway to death. Like I'm 16. Well, that's another year. Like I'm getting closer and closer. And it wasn't like a, you know, seize the day. It was like a, oh my God, I'm, what the hell do I do? Like, what am I going to do with myself?
Yeah.
Something happened when I turned 20 where there was like a flip, and it was this like, okay, you've got like 10 years. Sweet. What a gift that nobody else is afforded. You get the number. You know that you're gonna like you have until 30. Yeah. So what do we get? Like let's fill up this calendar with crazy rad shit to do. Like every decision I made from like that moment on was, will this make for a good story? And if the answer was yes, I would just do it. Even if it was the dumbest thing, like dumbest idea ever, if it was a good story, yeah, I'll do it. And it became like I became this, you know, I was like the stereotypical like guy in like the National Lampoon movies where he's like, it's like, oh, he's the fucking, that guy will do anything. Like he's
like a Van Wilder.
He's the Van Wilder guy. Like that was sort of my like identity. And in doing that, there also came this sort of, I guess, like just by virtue of living that way, there came this consistent meditation on the notion that like, okay, yeah, like you've got 5 years left. You've got 4 years left. And eventually it became, I was so comfortable with the idea of my death that I was like kind of excited. You know, I was like, I get to experience, who knows what happens? Like, it's going to be very interesting. And also, I don't have to worry about my body aging. I don't got to worry about saving for retirement. I don't have to worry. I don't have to worry. Life is hell. Living is hell. Living life is just suffering. And so you get to like, you don't have to deal with that bullshit.
You kind of have to, you got to, at least at that time, skip it.
Yeah.
Skip the bad part.
That's it. It was like, oh, I get to check out before everything goes downhill, you know?
Yeah.
And it was kind of awesome. And then a couple of years ago, you know, I turned 30 and I was like, okay, well, you know, the advancements of treatment and stuff, it's probably more like 40 now. So when I turned 30, that was a huge deal. It was like really,
Yeah.
really cool, really exciting.
So that's your life expectancy now, about 40 years old?
Well, about 3 years ago, there was a medication that came out for people living with CF called Trikafta. It's a gene modulator.
Yes.
And when I started that medication, my lung function was at 50%. End stage CF kicks in around once you slide past 30%. My lungs were on this very steady trajectory going downward. And I was like, thinking 40, I'll be very lucky if I see 40. That would be amazing. When I started Trikafta, I was at 50% lung function. 2 months into taking the drug, my lung function shot up to 85%, which is where it's been for the last 3 years. Started gaining a bunch of weight. I still have CF, but for the most part, I can't even tell that I have CF. It's not a cure. Like genetically, I still have it, but it's pretty goddamn close to a cure.
Do they know yet if that means you'll live in like a normal life trajectory, like you'll die of something else that's not CF?
I think the assumption is that's probably the case.
Whoa.
I don't think that they have enough data to say whether that's true or not. But the way that things look, there's no reason right now why that wouldn't be the case because of the extreme improvement that most people who have been on Trikafta have seen. And so now I'm like, okay, that notion of like a life expectancy, now it's like, it's probably like 80, I don't know, or more. It's been wiped away. There is no more like, oh, time's running out. It's like, oh, God damn it, I got nothing but time.
So what's that been
I
like?
fucked up
do you
so
feel like it's
bad.
too much time? Like, 'cause you
I
gotta
didn't
think
save.
about RSPs and shit now.
That's it. I mean, so yeah, like honestly, it's funny when I tell people about Trikafta, it's this funny thing where it reminds me of like the early days prior to Sickboy when I told people I had CF and they would go, oh. And now I tell people about Trikafta and they go, yeah, that's amazing. And there's this part of me that wants to so badly go, yes, and it is not that amazing too. Like it is also so like complicated.
Cool.
Yeah.
Yeah.
And it's true. Like it is the most complicated feeling of trying to wrap your head around all of a sudden just being given when I say I really was accepting the fact that I was going to die, like I really was there. And then it was like I had that pulled away from me and it was kind of jarring. It was like, uh-oh. What does this mean now? Like every aspect of my life all of a sudden was kind of like, oh, how do I deal with this? Like, it was very, very muddy, very cloudy.
I remember as a kid being deathly afraid of eternity, the idea of eternity.
Oh my God.
Like you go to a heaven or a afterlife and you're just, I think I was a comedian said you're at a party, but you can't leave.
Yeah. Yeah.
And that was like the most terrifying concept. And I wonder if you had some of that fear. Like now you have 50 more years. That's a freaking eternity. That's scary.
Yeah, it is. I have dealt with it. So, I never thought kids were completely out of the question for me. I mean, partly because I don't have a vas deferens, which
there's something where you can't have kids, right?
But I can. It's just, it would be through IVF, like in vitro is the option. Yeah. But the idea of going through IVF, I was like, oh, absolutely never. Like I would never want to bring a child into this world only to leave them fatherless before they graduate. Like I don't want to do that. Now that's completely changed. And I'm like, oh God, I'm almost 40. I better, I don't want to have a kid. I don't want to birth the first child after I'm 40. I don't know why. There's just like a part of me that's like, I don't want to be an old dad now. Like I want to be a dad now, but I don't want to be an old dad. So like that that like decision, that one choice of being like, okay, I want to be a father. That is one of like many, many different sort of opportunities or doors that have opened that have made that potentially 50 years a lot less daunting and much more exciting, right?
Were you thinking about legacy and like leaving something behind when you were in the mode like, hey, I'm going to die when I'm 30? Was that something that occupied mind space for you? How are people going to remember me? Will people remember me?
Yeah. Sickboy was that.
Yeah.
Like I used to say, like, I'm not going to have a kid. This is my kid.
Oh yeah.
Like I want to foster this thing and rear this thing into something that becomes a contributing member of society. Like that was the idea.
And that was important because you wanted something that endured beyond yourself.
I think, well, I never thought about it from that point of view of like something that endured beyond me. But I suppose, yeah, like the idea in my head was like creating this thing that cultivates a community or a way of thinking or a way of like approaching tough subject matter that extends out and becomes a integral part of other people's lives based on what we've done. So like, creating a community that exists. Like, cause for me, when I was growing up, with CF, I always had this like low key guilt that I was not advocating for CF.
Oh,
and
yeah.
I think that came from like, I had been to a bunch of like advocacy events, like the walk for CF. And I was always like, God, this is so, who wants to walk for anything? Like, this is so dumb. Like, I just didn't connect with me. And so I think I just like always felt like, oh, well, there's no way for me to advocate. Like, I don't feel like there's a way for me to contribute in a way that like feels valid for me, that connects with me. And then when Sickboy came along, I was like, oh, dude, this is it. This is you're advocating here, but it's greater than just CF. You're advocating for everybody that's living with some sort of illness or hardship. And so I think the advocacy bit really like spoke to me. And that was the thing that sort of bred into this idea of like, let's build a community around this. And that will be my legacy. That will be the thing that I'll leave behind, because it's not Sickboy, like, especially when we started having guests die on us, like past guests, every like couple of months, we'd hear that so-and-so passed away because of their cancer, because of whatever they were dealing with. And we would have family members reach out to us after their death and be like, I just want to say thank you for recording that episode with Andrew, because I know that from this moment forward, whenever I miss him, I can tune into that episode and hear him talking and hear him laughing. And like, it became, that was like an eye opener for us to go like, oh wow, right. We're sort of creating this time capsule for loved ones to reconnect with someone who's died, or for someone to reconnect with themselves after they've gone through it or come out the other side, or have like evolved in their thinking in the way that they relate to their illness or what they've been through. And that was also just a really cool kind of like, okay, yeah, this is greater than, this is much more important than like three friends making a couple dick jokes with some person who's living with an illness. Like there's layers to the importance of this that really reach out with these tendrils and like truly affect people that are tuning in or that have the ability to access this.
Yeah, and I think like it's so like that, because that becomes your identity. It's probably dehumanizing. Like, you become less of a human and more of an illness, and you're returning that to people with a human conversation, and it's about them. You're featuring them. And I sense this too in my hospital work, that this is not how the system is supposed to be, but you do get dehumanized in the medical system because you are a patient. And like literally as a doctor, you're trained to take care of that one type of patient and then do it like 10,000 more times in your career.
Yeah.
So you get really good at it. It's a trade. So that's dehumanizing. You become the illness. You know, when we, even in our hospital notes, 43-year-old male Andrew diagnosed or comes to hospital because of, you know, lung cancer. Like you become that thing. So I think it's really great what you're doing to try and return some of that humanness and individuality to those people at a time when they're becoming defaced in some ways.
Yeah. Yeah. And to, you know, it's funny because like I think that is, it's just a part, it's inherent, it's a part of the job. Like speaking to physicians and healthcare providers in general, for the most part, there's also this sort of protection mechanism where it's like, well, I can't open myself up to every patient to feel that sort of like human to human connection, or else it's going to destroy me. You know, like you only have so much energy to give. And I think that for a lot of patients, they see the way that they are treated or the way that they feel when they go through the medical system, and like the scapegoat is the physician, the doctor, or you know, it's usually the doctor. It's like I love my nurses, but my doctor's a prick, and it's like they've got to blame someone. And we started to notice this a lot in Sickboy, where we would hear this mentality of shit talking the doctors because of a bad experience that they had or whatever. Yeah. And something I've always kind of felt pretty strongly about is that I don't think it's the physicians. Yeah, there's shitty physicians that exist out there. There's bad people at every job that exists. So like, yes, you're going to have a couple bad apples. But also, there's so many layers there. It's so nuanced, and it's not just as easy to just accept that it is the doctor who made my experience bad or whatever. So that's when we started to open up the podcast to also speak to physicians and healthcare providers and professionals, people on the other side of the table, to be like, hey, by the way, let's get an understanding of the scope of the work that these people do, so that we can also see that we're all in this together. Like, yes, your physician could allow for a little bit more openness and human to human, like loving embrace, you know, that is professional and yet still human. But also you as a patient, like, just hear these people out, because you also are there. It's an exchange between two people, not just, you know, there's not one side to any of this. And so, like, you know, I think there's room for all of us to kind of be more accepting and like allow for that humanity to come through in the cyclical way that like everyone's included.
Yeah, not easy. Like, well, not easy to prioritize that as a doctor, the humanness of the patient. You might think, or one might think, oh, that's wild. Like, how could you not? There's a human sitting in front of you. Like there's oncology clinics, and this is not a bad thing. We should see high volumes of patients so we get good at what we do and provide treatment to as many people as possible. There's oncology clinics where you'll see 12 people in a day, but they all have terminal cancer. So you can't possibly. I noticed that going through medical school, like you especially in palliative care. And I did a decent amount in my training in palliative care psychiatry. You just can't possibly feel the same emotional experience as the person who's dying, their family members who are grieving them. You literally would lose yourself. You can't. Yeah. And then you can't be there for the next 11 patients that day. So it's impossible. So I'm not surprised to hear that doctors do become the face of some of the anger or like you always hear, especially in cancer or all terminal illness, you always hear like, the doctor gave me 6 months to live and I'm still here. It's like, it's kind of like the fucking doctor gave me 6 months. I'm going to show that doctor. I bet that doctor hated telling that person that they have 6 months to live. It's not a boxing match. You didn't enjoy doing that, but they always say that, oh, the doctor like they gave me 6
Yeah.
months.
Yeah,
I've
and you
always found that
picture
to
this
be a
doctor
funny
just
thing.
going, delivering the
6
news.
months.
Yeah.
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 Yeah, it's obscene.
But there is, I mean, there is. So, I think the reason why I had that, why I felt so strongly about that, is because I've actually, I mean, as someone who's like been in the cystic fibrosis clinic, this like specialized clinic, seen the same doctors for years and years and years, I've spent so much time. I'm very fortunate to say that I haven't had many situations or experiences where I was like, man, my doctor's a dick, because my doctors just treated me like. They treated me like a friend, and I know they're not my friend, but that doesn't mean that they can't like have an exchange with me where I feel like we are friends, you know? And so like that doesn't take a whole lot of energy.
I've always found that part of medicine interesting, where like at that time when you're being seen at 10, 11, 12 years old, you're going to the doctor every month, and yeah, there's modifications to your treatment, but really they all know the end result is you're going to die when you're 30.
Yeah.
But there's still medicine to be done there. And I've always found that interesting. The type of medicine where the condition is irreparable.
Mm-hmm.
And we see that a ton in neurology, and like my world and neurology are very interlinked, but
Mm-hmm.
these neurologists are like saints. They're like monks that just kind of, the people come in with these irreparable diseases that will kill them eventually and slowly and horribly. And they're just kind of there with them.
Mm-hmm.
And they tell them every couple of weeks that there's no further treatment. We don't expect a change in the terminal trajectory, but I'm here with you. And that's a part of medicine that it's a interesting part of medicine, because it's antithetical to what you learn in medical school, which is like you should and can treat everything.
Mm-hmm. Yeah. Yeah. And again, for that person in that situation, maybe for them being in that office with that one doctor who's going, look, we can't do anything, but like, I'm here. Maybe that doctor is the only person in that person's life that they feel like this person gets it, and I know I can like have a conversation here with this person. Because everybody else, if I ever try to bring it up, it's all walking on eggshells and being awkward, and you know, there's like this heavy cloud. Everyone's tired of it. No one wants to hear it. Where I'm here with you, I can lay it out, and I can just get it off my chest. And like, I think that's, I mean, like, God bless the doctors that are there doing that sort of thing. But I also think that there's like that. I mean, that's the reason why we do Sickboy, is to be like, hey, like let's all be like open to really sitting down and being intentional with like having conversations about things that feel hard and sticky and tough, but moving through it lightly with grace and with levity, because it's like I think truly like one of the most valuable forms of like alternative therapy that exist out there. Just as valuable as your chemo. It's to be able to get that shit off your chest and to be able to talk openly and without stress around the communication aspect of it is just so vital.
Yeah, and laugh about it.
Mm-hmm.
It's awesome. Well, I love the work that you're doing. When you're here in Calgary, I'll send you a note. Maybe we could connect, or I can come watch your live show. That'd be awesome.
Yeah.
Be very cool.
Yeah.
Thanks for taking a little bit of time with us, and then just it was cool to chat. It was very cool to chat, and we covered a lot.
I hope
totally what to expect.
I
but we got
wouldn't
into a
cover
lot of
too
different
much.
stuff, so it was cool.
Yeah, well, I had a lot of fun. Thank you so much for reaching out.